Dr. Brad Condor, Focus Physical Therapy. So today we're going to demonstrate what an actual physical therapy session should look like as far as how we do it, but also, in my opinion, what it would be best as far as research to get our best outcomes. Physical therapy in research has been shown for a long time. We should be the very first person anybody goes to for musculoskeletal disorders. Anything from neck pain, back pain. You know, we have the training to take care of people from the very first injury all the way through. In healthcare, you know, there's a lot of kind of things that are being done that isn't always efficient as far as getting people better the quickest, but also with money. And so in the state of Kentucky, people can come to me directly for physical therapy without having to get unnecessary testing or even some other interventions that aren't going to help them. And one thing I usually tell a lot of my clients is that, you know, when it comes to musculoskeletal disorders, which includes muscles, bones, joints, discs, anything from the musculoskeletal region, physical therapy is the best option because you only really have you only have 5 options ever for any type of injury. So even if you blow out a disc in your back, your options are always the same no matter what. You can either do nothing, you can do physical therapy, you can do injections, medicine, or surgery. Those are always the options. But oftentimes with a physical therapy session, we can rule out the serious needed interventions right away. And if they're not needed, we go right into treatment and get you the most efficient recovery from your injury. And then we're trained enough in school and with our education that if you do need extra help, I can get you to the right person instead of going through all the steps of getting to the wrong person. So today we're going to demonstrate what an actual physical therapy session should be like. This is Colin. He's here today for his low back, which is some of our most common complaints that we're going to see. Neck pain, back pain. 90% of Americans are going to experience significant neck pain or back pain at some time in their life. And what we want to try to get them to realize is that there is hope to get these things managed correctly and for lifelong options for them and solutions for their conditions. So when it comes to physical therapy, like I said, in the state of Kentucky, now the reason I say that is not every state's the same, but most states are similar. You can come to me directly. So if you hurt your back at work, you're having pain, you can come to me directly, I can tell you your answer. So what this conversation will first start with is like the interview. So just some examples of what we would ask is like, first of all, where are you having your pain?
It's right there in my lower back.
Okay.
It's not quite, you know, it's not really low, it's just, it kind of feels like at the bottom of like where my chest would meet.
Okay.
Just right there in that spot.
Did you do anything specifically to cause this?
I think it's just been gradually getting worse over time, but just pushing something over my head, and I guess I arched my back too much, and I felt like a pop in that area, and then it's just never been the same after that.
It is really common for most people, especially spinal-related conditions where you don't have an actual injury. Most people, actually, their injuries are built up over time, and it's a cumulative effect of what we do in our life. Whether we sit a lot, drive a lot, you know, or do activities, it's usually cumulative factors. So there's usually not one thing that's giving that, so that's a pretty common issue. Now, in the spine in particular, I mean, when we're seeing any type of condition, you know, we're trained enough to be able to know some serious signs and symptoms that might need more than physical therapy. So, for example, in your back, do you have any numbness or tingling in your back?
No, not really.
Down your legs?
Mm-hmm.
Any weakness?
No.
As silly as it sounds, a lot of times even just doing reflexes, even though you go to the doctor, I've had patients tell me they go to a neurosurgeon, they're like, all they did was check my reflexes and made me stand on my toes. And there's a kind of a reason for that too. So let's sit back for a second. Okay. All right, let's get your wrist here, or your wrist, just your knee. Yeah, no reflexes, no option. We did have them right off the bat. There we go. So I did have a little bit of a reflex. So reflexes tells us is that if there's some type of neural compromise somewhere in the spine that we might need to get taken care of more than physical therapy. Now stand up for me. Go up on your heels. Go up on your toes. And that's good. Good. You're going to have a seat. So as weird as it sounds, a test like that would show us that he doesn't need to go to a neurosurgeon because the nerves aren't pinched to where it requires surgery. And those are oftentimes simple things that a neurosurgeon would do as far as the decision-making process between surgery. So the whole point is, a lot of times when you come into physical therapy, we have simple tests and measures and the history taking to be able to tell you you don't need surgery. And even injections, with nowadays, they know that, you know, we still might go the physical therapy route in the beginning. So now we're getting here early, so we don't have to go through all those extra steps.
Okay.
Now, we also can refer if needed, and that's where we need to be that gatekeeper for musculoskeletal disorders. Now, as far as physical therapy outcomes, this has been shown in research for a long time. The best outcomes going to come from a good, thorough evaluation. Also, very good manual therapy and good exercise prescription. If you leave out any one of those types of interventions or treatments, you're not going to get the best outcomes. And so the way that we do physical therapy here is that I'm going to do the assessment today. We're going to do a couple easy tests, not everything. I'm going to demonstrate a couple easy manual techniques and then some exercises. Now, in a full physical therapy session, it could take anywhere from 30 minutes to an hour. But you need that actual time for both to actually get the best outcomes.
Okay.
And if you don't have that much time, then we might be missing the boat as far as what is good. Like just doing exercises isn't always going to get you the best outcome, and just doing manual therapy. Okay, so go ahead and stand up here for me. So easy test that we might do for the back range of motion. See what kind of increases your pain. Kind of look at the spine, see how it moves, what increases its pain. Come on back up. Do a good back bend. Good. Any pain?
Mm-hmm.
Did you have a lot of mobility, but did you have any pain going forward?
Yeah, just a little bit.
Okay, good. So there's other tests and measures that we would be able to do as far as the low back, but today, for time's sake, we're not going to go into all those. Okay, so can you do me a favor, go ahead and lay in your stomach with your head down there? Good. So a common thing that people don't always realize as far as physical therapy, especially in orthopedic physical therapy, is that we're training in a lot of different hands-on techniques to actually help with pain and restoring motion right away. So some common techniques that we would do is actually palpation and joint mobilization, where we real gently get to a joint and make sure that it has good motion, which we could do all joints to mobilize and restore motion. Actually do hands-on massage and myofascial techniques. We do a technique called dry needling, where you use acupuncture needles to release trigger points in the back for pain relief. Or even joint manipulation, where I would actually get him into a position. Go ahead and on your back. We would actually manipulate the spine as well, which Collins had this done before, and it's been helpful for him, to where we get into a particular technique and we actually get his spine to get moving again in the proper way. So you can go stand up back in. Now these techniques, each individual therapist has been trained in these. Some therapists are maybe more skilled than others, but for the most part, every orthopedic therapist should be able to give you manual therapy that you need to kind of have your pain relief right away and restore motion. Okay. Now the exercise component is a little bit, I wouldn't say trickier, but a very important component that doesn't need to be kind of brushed over lightly. We don't want generic exercises, because the generic exercises are a different program, but we want to, when you're in physical therapy, we want to prescribe exercise. That means whatever works best for you to get this better. For example, go ahead and lay on your back again. So his back actually hurts and is tight with flexion. It actually feels good with extension, so we might actually promote extension-based exercises, so bend your knees. So because the extension actually feels good, we want to strengthen the back muscles. Bridges might be a good exercise, so you can do a bridge. Good, come back down, no pain. And what we want to do is make sure that you're doing the right frequency and duration on a daily basis, as far as how many reps to do to actually get muscles to gain strength and get endurance. Okay. Some other common exercises you might do to kind of help with mobility is stretching. So those are usually the main exercises that we'll do: stretching exercises, range of motion exercises, then followed up with strengthening. Okay. So some common exercises we might end up doing is hip stretches to kind of help with the piriformis muscle and tight muscles that happen with the back. You can hold your hands here. We will teach you how to do how it should feel, how many reps to do, with your frequency, and so on and so forth. Okay? All right, you can see that. Of course, that's just kind of the tip of the iceberg as far as the interventions and exercise you need to do. But we wanted to kind of cover what a good physical therapy session should look like. Physical therapists also do have available to them other modalities. Modalities means like ice, heat, electrical stimulation, ultrasound. Those have been around in physical therapy for a long time, and they're not necessarily bad. But a lot of times in physical therapy session, just doing this type of approach, those aren't necessarily needed. We want to kind of give you the best research-based treatment, which is good assessment, good manual therapy, and good exercise prescription, and do that follow-up, and this will be your best long-lasting treatment for your back.
Okay.
And for all musculoskeletal conditions.
Okay.
And that's it.